Welcome to London Valve 2024. I'm Madalina Garbi from Royal Papworth Hospital, Cambridge, UK, and it is my pleasure to have with me Joao Cavalcante from Minneapolis Heart Institute. Joao, multi-valve disease poses challenges in diagnosis of severity with echocardiography only. What can multimodality imaging add?
Thank you so much, Madalina and PCR, for this opportunity to be here with you today. Certainly, there are pitfalls and there are challenges that we have to recognize, right? The assessment that we use by Doppler has some challenges when we face with a regurgitant valve disease and a stenotic disease. Let's take, for example, low flow, low gradient. It's important to recognize that that exists, but what is causing that low flow? Right? When you have mitral regurgitation or tricuspid regurgitation, the gradients are going to be lower because there's not enough flow. Assessing the morphology of the aortic valve is important. Does this patient have severe AR? Can you look at the calcium score? Can I look at the planimetry of that valve? That's the role that CT plays in the calcification assessment, as well as the planimetry of the valve, and understanding that after I tackle that aortic valve, do I need to still relook and revisit the other concomitant valves?
Multi-valve disease acts synergically on the cardiac chambers. How can multimodality imaging help us assess the cardiac chambers better?
Yeah, that is another group of difficult patients. We have to recognize that we have to develop more knowledge and also evidence for multivalvular disease. When you tackle, for example, two regurgitant lesions, you can think of, are they in the same ventricle? For example, aortic regurgitation, mitral regurgitation. In that case, that left ventricle is facing an enormous double volume load. So that ventricle is going to dilate, is going to stretch, is going to remodel substantially more. And then you need to understand, if I fix the aortic valve, if it is a functional mitral regurgitation, what happens? Maybe that will get better as the ventricle remodels back. Or do I need to tackle both if I have a flail mitral valve leaflet and aortic regurgitation? When you have, for example, now two regurgitations in separate ventricles, mitral and tricuspid regurgitation, very common. Severe secondary mitral regurgitation. Almost half of these patients will have TR. If I tackle the mitral, what happens to the tricuspid? Do I need to revisit that? And that's where cardiac MRI can come in. Assessment of the remodeling, assessment of the severity in each one of these two chambers. Because we need, and we understand nowadays that just doing a job in one valve might not be enough.
Thank you, Joao. That's very helpful. So when we see multi-valve disease for assessment of severity, we use multimodality imaging to enhance our ability to have an accurate assessment. Particularly, you gave the example of CT in aortic stenosis with low flow. And when we have multi-valve disease, again, we can use multimodality imaging in the form of MRI for a reliable, reproducible method of follow-up of patients with multi-valve disease. Thank you so much.
Thank you.